Good morning. Welcome to the Unitarian Universalists of Southold, formerly the First Universalist Church of Southold. Whoever you are, wherever you come from, whomever you love, we welcome you. Today we are gathering on the traditional lands of the Ammonhansuk Nation. My name is Virginia Cava, and I'm a member of this congregation. We are so glad to see you, whether you are visiting for the first time or come often. If you are not on our mailing or email list, please sign our guest book on the welcome desk as you enter from the parking lot. And you will then receive the Free Spirit newsletter each month and hear about upcoming events. Copies of the newsletter are on the action table to the left as you enter behind me in the vestibule. Please like us on our Unitarian Universalists of Southold YouTube. And we stream our services there, and you can find past services archived. The action table has other information, and we'll carry other as you leave, that you may find interesting. Also for your use, masks and hand sanitizer. We offer many ways to serve this community, from providing hospitality, flowers, and ushering on Sunday mornings, to joining our social action and other committees. Please stay after the service for coffee, refreshments, and lively conversation. On the back of your order of service are announcements. Read them briefly. We have a lot of things going on in January. In the meantime, please fill out your bingo game. January 13th and weekly, we have the yoga meditation with Nancy Baylis. It's a really wonderful session with her at 10:30 a.m. January 14th and weekly, we have Charlotte's music class and piano, voice, and chorus. I can certainly use that, I think. January 14th, we have SAC and 8th Principal Task Force at 4 p.m. January 14th, we have a board meeting in person and on Zoom at 5:30. January 16th, we have our Soulful Sundown, the first of the year, and the Hot Jupiters will be performing. January 17th, we have a community dance lesson, the second in a series, and it's going to be the rumba this time at 4:30. January 18th, our Sunday service is Caring for the Path We Follow with Reverend Valerie. And January 25th, the North Fork Action Center has a meeting at 4 p.m. Are there any other brief announcements relating to the life of this congregation?
Although it's not on the back of the order of service, Joe McKay will be speaking on the 25th. He's one of our most popular speakers, and we usually have quite a crowd. And the most exciting program that I feel is about to happen at this church is a program where we are going to be providing a safe place for Hispanic, Latina mothers and their children. And it is a program that's been done by NYCLU Suffolk in 3 different places very successfully. And the goal is to have the mothers become empowered, to be much more actively involved in their children's education and feeling much more confident about their life here, which, as you know, is a real obstacle for so many people. And we have our first meeting, 8:30, or it says 9 to 11:30 in the morning on Martin Luther King Day. I have flyers that I'll be putting out back. We really need to get the word out to the mothers. I hope that if any of you know young Hispanic women who could use this program, please feel free to take a flyer and give it to them.
Anyone else? Now it's time to greet your neighbor. Please join me as I light the chalice, symbol of our faith. Our opening words today are those of Kenneth L. Patton. This house is for the ingathering of nature and human nature. It is a house of friendships, a haven in trouble, an open room for the encouragement of our struggle. It is a house of freedom, guarding the dignity and worth of every person. It offers a platform for the free voice, for declaring both in times of security and danger, the full and undivided conflict of opinion. It is a house of truth-seeking, where scientists can encourage devotion to their quest, where mystics can abide in a community of searchers. It is a house of art, adorning its celebrations with melodies and handiworks. It is a house of prophecy, outrunning times past and times present in visions of growth and progress. This house is a cradle for our dreams, the workshop of our common endeavor. Please join us in our opening hymn, As You Are Able, number 1026, verses 1 and 4, If Every Woman in the World, in our teal hymnal. Please join me in our words of affirmation. Love is the spirit of this congregation, and service its law. This is our great covenant, to dwell together in peace, to seek the truth in love, and to help one another. Now we will accept an offering towards the work of this congregation. Now we will drop a stone to express our joy or concern. I'll go first. I'll take the liberty of going first. I don't even have to name the amount of concerns I have, and so I drop a stone for that. But also joy that we're here together, that we have people of like souls and interests to gather together and express ourselves. Anyone else?
I'd like to drop a stone of appreciation for the work that Planned Parenthood has done for many years for women's health. I'd like to drop a stone of concern that people who are speaking out and protesting, such as this afternoon, there's a big one in the city, that they are safe.
Good morning. I just want to drop about a handful of stones to say thank you to all of you who were wishing me getting better for my stupid broken hip, which actually happened, I just counted on the calendar, I think it was just 8 weeks ago that I didn't make it into church that morning. So I really missed you, and I really felt you all reaching out to me, and it was wonderful. So I'm glad I'm back, and I'm glad to see all. I also want to drop this. Oh, so here's a few stones for that. And I want to drop a stone for Ben Burns. That's confusing, because he was a fellow resident with me at San Simeon, and we were in the same PT class. And I didn't know him. He's a former minister of a Methodist church here in Southold. And I never really knew him, but I knew of him because he was famous for being such a wonderful person. So I finally said, Ben, I think I really should know you, and I think we know each other. So we struck up a few conversations. And one of the fun things that we discovered is that we're alums of the same college. We're both Pacific Tigers from the College of the Pacific in Stockton, California. So I'm saying go, Ben, and I hope he comes home soon too, because San Simeon is okay, but home is better. So this is for Ben. And then this is one more to echo what we're all thinking about the world right now. Praying for hope and a new world, because that's what we really need.
Well, speaking of Ben Burns, a lot of you know that he lives with my mom when he's not in San Simeon, and his saga started in June when he fell at his church. And the good news, at least let's hope, is he should be in 2 weeks. Since June, it's been off and on. So.
Hi, I'm Carolyn Holstein, and I just wanted to report back to you, this is something wonderful, that the Guest at Your Table program through the UU Service Committee has raised $4,500 from this little congregation between all of your contributions and the amounts that were matched. So congratulations, and it's something to be proud of, because they are doing the work that is needed in this world.
I have a particular joy today, and that is that we do have Kaitlyn here with us. My sister, who is a rabid supporter of Planned Parenthood, I have a memory of her sitting at the kitchen table on the morning that she was married, 1961, I believe, praising the fact that there was now a birth control pill. Of course, she's devastated by what's happened, a tremendous warrior for reproductive rights, and I'm very happy that I was able to do what she's been asking me to do for several years.
Anyone else? Remember, there are always sorrows that go unspoken for many reasons. But in our hearts. Our responsive reading today is number 519, the words of Rabindranath Tagore. Let me not pray to be sheltered from dangers, but to be fearless in facing them. Let me not beg for the stilling of my pain, but for the heart to conquer it. Let me not look for allies in life's battlefield, but to my own strength. Let me not crave in anxious fear to be saved, but hope for the patience to win my freedom. Grant me that I may not be a coward, feeling your mercy in my success alone, but let me find the grasp of your hand in my future. I'm so pleased to introduce Kaitlyn Pawlukojc today. She is a licensed social worker. She's the coordinator for advocacy and government relations for Planned Parenthood in Hudson, Peconic. Please welcome Kaitlyn.
Good morning, everyone. I'm just going to create a little bit of space here. Thanks for having me. It's really nice to be present with you all and to have such a warm welcome. I was sharing, these are divisive times, and there are strong responses to the organization that I work for, proudly. So great to be here. And I'm excited to share our priorities with you for this upcoming year. So at Planned Parenthood Hudson-Peconic, our mission is to empower individuals to determine their own sexual health and reproductive futures. When I served as a Peace Corps volunteer in Tanzania, where my assigned role as health educator primarily focused on HIV and AIDS awareness, I found most of my conversations revolved around combating stigma. This stigma created a veil of misinformation around the disease. People did not know how the virus can be transmitted, and so did not take necessary precautions. They did not know about the available medication, and so hesitated to get tested. They did not want to become ostracized by the community, and so they did not adequately take care of their own health once sick. In working at Planned Parenthood Hudson-Peconic, I have found that stigma around sexual and reproductive health care, especially abortion care, creates similar barriers to that care, right? These barriers propped up by shame and disconnection. There is the assumption that a person did something wrong or should have known better, and so somehow deserve the consequences, right? This attitude does not allow for the best medical care a person needs. Only in listening with compassion to a person and providing them all their potential options can we even begin to say they are free to choose. What is also surprisingly similar between the communities I worked with in Tanzania and those I work with today is that even if a person makes a choice, right, to treat their HIV or to terminate their pregnancy, the options may not be available due to policy limitations, financial restrictions, and geographic location. In the village where I served, people living with HIV had to travel once a month to the district hospital so medical staff could monitor their CD4 levels in their blood and administer medication as necessary. Such a trip meant leaving home and field for at least a day, sometimes two, especially problematic during peak farming season, as well as rainy season with impassable roads. And this trip cost about a week's worth of pay, if people even had that much money saved, right? Living day to day as they were. And of course, taking this trip once a month, they had to make up an excuse as to why they were gone or for so long or traveled so often. And medical care here in the United States, including in New York, for people seeking abortion can be equally inaccessible for similar reasons, right? Curtailing that right to the freedom of choice. And so to help change that reality, I am proud to advocate for increased access to comprehensive sexual and reproductive health care with Planned Parenthood Hudson-Peconic here in New York State. For over 90 years, we have provided exceptional health services accurate and information and education, as well as fearless advocacy for reproductive rights and justice, right? We consider this our three-legged stool. We offer a wide range of sexual and reproductive healthcare services, regardless of an individual's age, race, ethnicity, religion, gender, sexual orientation, gender identity, immigration status, or ability to pay. As trusted healthcare providers in Suffolk, Westchester, Rockland, and Putnam counties, our 10 brick and mortar health centers, 2 mobile health centers, and dedicated virtual health center offer non-judgmental professional treatment, confidentiality, and affordable high-quality care. In 2024, services were provided to over 27,000 patients in over 46,000 visits. And Health Center offers services such as birth control, emergency contraception, prevention, testing, and treatment for sexually transmitted infections, HIV testing, counseling, and treatment, including medications PrEP and PEP for HIV prevention. They provide prenatal care, gender-affirming care, gynecological care, vasectomy care, the HPV vaccination, abortion, menopausal management care, life-saving cancer screenings, and much more. And so this is what I mean when I say comprehensive sexual and reproductive health care, right? Taking care of people of all genders throughout their reproductive ages. In 2026, this year, we are renovating our Patchogue Health Center to update the space and increase our capacity to see patients. We are also continuing to expand our mobile health center partnerships so we can reach more people in our communities who may not be able to find reliable transportation to our brick and mortar health centers. And the mobile health centers provide much of the services that we provide at our independent locations. And so that was our first leg, right? Our healthcare services. We also provide education. So as informed educators, our education and training team offers programs providing accurate, inclusive, and unbiased information about human sexuality. We conduct programs in schools, colleges, residential facilities, civic associations, and community organizations, as well as for parents, and trainings for professionals and child care providers. Our education and training programs reached over 7,000 people last year. Again, it's important for folks to know how their bodies work and what best decisions to make. And as you were sharing earlier, that everybody of every body and whomever they love are welcome. So our third leg of our stool, advocacy. As passionate advocates, we follow issues related to family planning, sexuality education, and reproductive health to ensure individuals have autonomy over their own bodies and determination over their own futures. We have a strong advocacy program which works at the county, state, and federal levels to promote access to and funding for sexual and reproductive health care. We cultivate and support diverse, inclusive, and powerful coalitions in the communities we serve and build a base of informed, passionate, and powerful volunteers to use their voice. Last year, we engaged with over 16,500 activists in our regions, again, Suffolk, Westchester, Rockland, and Putnam. Last January, I was inspired how our activists showed up for our state budget campaign. We initially had concerns that volunteers would be uninspired by the numbers, right? That government spreadsheets were not where they expected to enact great change. We found, however, that people were motivated by our priority to modernize pregnancy loss reporting, a policy that we were advocating to be included in the state budget. Up until last year, providers were required by the state to report any pregnancy loss in a way that is archaic. They had to hand write on triplicate forms, right? Those carbon copies. When was the last time you used or saw a carbon copy? It was administratively burdensome. Some of these copies had to be hand delivered to county offices rather than mailed. And this process raised significant concerns for people receiving abortion care in New York, because not all of the entities handling the data at county offices are HIPAA compliant. So your personal health information was going to county people who weren't responsible for protecting that health information in the way that your doctors and nurses are. And so with the currently hostile federal administration seeking to limit access to abortion by targeting both providers and patients, our volunteers knew this provision to increase privacy was more important than ever. They wrote with a passion, like letter after letter. Their hands were getting tired. They would pause and massage them. They stayed for hours. And then they even brought templates home of these letters and the language to ask their family and friends to write as well. And so I'm happy to report that their efforts were successful, and the state government agreed to change this process. And so while we achieved great successes in securing necessary funds and provisions for sexual and reproductive health care during last year's budget campaign, with continual cuts at the federal level, the threats to healthcare access are real and ever present. At this time, when our fundamental freedoms and rights are under attack, we urge New York leadership to rise as the bold, unwavering resistance our nation needs. We cannot simply hold the line. We must push it forward. The forces of misogyny, racism, and transphobia threaten our freedoms, our safety, and our dignity. Their goal is division. Ours must be unity. Our strength is in solidarity. And our work must be guided by the truth that the fight for reproductive freedom is inseparable from the fight for economic and social justice for all. At the heart of our shared well-being is the ability to live freely and authentically, to build families on our own terms, and to pursue our dreams without fear or obstruction. This is the future our state must not only defend, but deliver. As we look to this coming legislative session, we are urging action on the following budget priorities to increase financial stability. Number one, backfill Planned Parenthood's Medicaid defund. In July of 2025, language was enacted in the Federal Reconciliation Bill, H.R. 1, that prohibits Planned Parenthoods from receiving Medicaid funding. So we cannot reimburse for any of our services, whether HIV testing, pregnancy testing, STI testing, cancer screenings. We cannot reimburse for any of those services through Medicaid. And about half of our patients are Medicaid patients. We're still seeing them. We're just unable to access federal Medicaid money. And so, safety net providers like ourselves, like Planned Parenthood, have been struggling for a long time to sustain services after decades of underinvestment and rising costs of delivering care. right? We know that even when we reimburse through Medicaid, it's not for the full cost of that service compared to a private health insurance company. And so without state support, health centers have in New York and will close, right? Access will be irrevocably altered. There are not other health centers that can pick up the patient load that would be there with health centers closing. So in recognition of this, Governor Hochul did commit in October to backfilling the loss of federal Medicaid money by allotting state Medicaid money. But we must ensure that the state budget reaffirms this commitment to protect access and care moving forward, right? So adding it to the yearly budget. And it's not just coming out of emergency funds, because that is not sustainable for us or for the state. Number 2, we would like additional funding for the Reproductive Freedom and Equity Program. In 2022, Governor Hochul made a historic investment into new grant funding to support abortion access. And this action was intended to support the expansion of care. But for many providers, it was desperately needed funding to retain access points already faltering. And so funding for this grant, this Reproductive Freedom and Equity Program, has remained flat since its inception, right? Despite the increasing attacks on abortion access and the rising costs of care. As I was sharing earlier with my example from Tanzania, people need funding and support to receive abortion care. And sometimes that's transportation. Sometimes it's child care, right? They're taking a loss from work. And so people need that support. And we know that most of the funds, over 60%, have gone to New Yorkers. We also know people are coming from other states to our state to receive care because it is banned in their states. And so they need greater support. Their travel is much farther. They might have to stay over at a hotel. So some of this is helping that, in addition to the providers, again, kind of close gaps in reimbursements. And so for the last 3 years, there's been no increase in funding, despite an increase in need for this support for folks seeking abortion care. Our third priority is sustained funding to support the provision of medication abortion and care later in pregnancy. And so last year, the budget was approved that included funding to support access to medication and care later in pregnancy. And this was a deeply needed investment, again, to address unsustainable low Medicaid reimbursements for these critical services. Unfortunately, providers have yet to receive this funding. So it was approved last April, May, but there's been no mechanism for it to be distributed to providers. And so the need continues to grow. Medication abortion is more common than in-clinic procedures. And so we are asking New York to maintain this investment, right, to continue it into next year's budget, but also to figure out a way to distribute it so that, again, providers can keep their doors open and sustainably deliver care to patients who need it and deserve it without these financial barriers. Number 4, we're asking for sustained improvement for funding for sexual and reproductive health care providers. And so since the Dobbs decision, which reversed Roe v. Wade, the governor has included funding annually to address security needs of abortion providers. And this funding stream is vital for providers to address the unique needs of their individual health centers, right? Not only supporting security upgrades, like all of our ground floor windows are bulletproof. And so they're really thick, the doors are really heavy, right? And all of that has to be, unfortunately, in this world. So money to help centers, right, renovate, keep their patients and providers safe. But it also, this funding helps health centers facilitate debt retirement, right? So again, there's a running theme through this, like underfunded healthcare, right? Reproductive healthcare has been siloed away from standard healthcare and is seen as separate and not essential. And so it's always kind of operating at a deficit. Our last priority, I know they all start to sound the same after a while because their base, like I said, need is constant. So we're asking for additional funding to support the Family Planning Grant. The Family Planning Grant is critical to facilitating access for a range of essential primary and preventative reproductive healthcare services, specifically for low-income, uninsured, and underinsured individuals. However, the grant, again, is seriously underfunded and is currently at risk due to the Trump administration's pending budget and regulatory actions related to the federal Title X family planning program. So sometime last year, entities that were receiving Title X family planning money were no longer able to access it if they were supporting DEI initiatives. So if they were, again, the federal money is set aside for low-income, uninsured, underinsured individuals who do typically tend to be communities of color. And so if you are serving those communities, as the grant was asking you to, your funding was revoked. There are additional thoughts at the federal level of limiting that money or maybe even eliminating it from the federal budget altogether, just making it go away completely. And so currently for New York State, right, Title X, this federal family planning money for birth control and contraceptive care, STI testing and treatment, pregnancy counseling, right, it covers all of those things, helps fund the New York State Department of Health for those services. And so again, if it's removed, there will be less access for people to get birth control and pregnancy counseling in New York State. So, a little dismal, but we are happy to be here, right? We as Planned Parenthood are so proud to serve the communities here in Suffolk County. We have 5 health centers throughout the county, and again, this mobile health center, and we have successes with budget advocacy last year. We are hoping to have the same successes. We know that the state is being asked to fill in a lot of gaps for a lot of services with the removal of federal funding for all sorts of things, food, education, other people's medical care. And so we are grateful for the support of the state leadership this last year, and we know we cannot rest on our previous successes because we know this current administration is actively hostile to healthcare in general, right? With the ACA subsidies, shutting down the government, and so they don't seem to want people to have health care. They certainly don't want them to have sexual and reproductive health care. And so this legislative session in New York State, which is starting this month and goes till the end of May, we will continue to advocate with our elected officials and state leadership to boldly invest in sexual and reproductive health care here in New York State, right? We pride ourselves on being an access state. And we know that it isn't always accessible for people. And so we want a more sustainable healthcare system for all. We have some ways to get involved with us if you are around and interested and available. The last Saturday of January, I will be writing letters again with folks. You can come and massage your hand, articulating these priorities to fund reproductive freedom. At the end of February, we will be traveling by bus to Albany to talk in person with our elected officials. The Suffolk County pickup is in Farmingville, so it'll be an all-day event, but transportation and food will be provided. And then I will leave here with you all on your activist table a QR code for our Suffolk County activist survey, ways you may want to be involved with us, and a QR code to share your story, if you have one, about your experience with sexual and reproductive health care, whether you were able to access it or not able to access it. We do find that decisions are made sometimes when the heart is changed and not just the mind with a bunch of statistics. So thank you again for the invitation to join you this Sunday morning. And may we continue to uplift the dignity and freedom of all birthing people together.
Today's meditation are the words of Dorothy Day. People say, "What is the sense of our small effort?" They cannot see that we must lay one brick at a time, take one step at a time. A pebble cast into a pond causes ripples that spread in all directions. Each one of our thoughts, words, and deeds is like that. No one has the right to sit down and feel hopeless. There is too much work to do. Our closing hymn is number 55, Dark of Winter. Please join us as you are able.
Comfort and caress me, and my soul may hear a voice, a still small voice of love. My fears arise, let your peace flow through me.
Our closing words are from Philippians chapter 4. Whatsoever things are true, whatsoever things are honorable, whatsoever things are just, whatsoever things are pure, whatsoever things are lovely, whatsoever things are of good report, if there be any virtue, and if there be any praise, think on these things. Please join me in these words as I extinguish our chalice.